Hi, my name is Kate Thompson and this is Moody, and today we will be going over vital signs. The first thing you want to do when taking vital signs of your horse is take a step back and look at the overall appearance of your horse. You want to look to make sure they have a bright eye, you want to make sure they're standing in a normal stance and don't look uncomfortable anywhere. First vital sign we're going to take is the mucous membranes. So to look at these, you can either use the conjunctiva of the eye or you can look at the gums. So the gums, you can just pull them up and we can see here that they are light pink and moist, which is what you want to see. So if they're dry, your horse could be dehydrated. If they are a pale color, it could mean anemia or shock. If your gums are yellow, it could indicate liver problems such as jaundice. A bright red could indicate infection or fever, and blue could indicate lack of oxygen. So you always want to make sure your gums look healthy and normal. Another thing we can do while we're up here by the gums is take the capillary refill. So to do so, we're going to lift the gums, press our thumb right above the tooth, and we're going to see how long it takes for the color to return. This should take 1 to 2 seconds, which Moody's did, and if it takes longer, that could be a sign of a problem. Next, we will be taking the heart rate of our horse. So our heart rate should also be 32 to 44 beats per minute, and we're going to take this with a stethoscope, and we're just going to take it right on the heart girth area behind the elbow. So we're going to put our stethoscope on. You want to make sure it's on by gently tapping, so it is on. Whenever you're ready, Gabby, go. So I got 7 heartbeats. So we again are going to multiply that number by 4, so this will be times 15 seconds. So 7 times 4 is 28, which is a little bit slower. But again, he is an older horse, and this is his normal. Next, we will be taking the pulse rate of our horse. To do so, you can take it in 3 places. You can do the maxillary pulse, which is here under the jaw. You can take the radial pulse on the inside of the knee here, or you can take a digital pulse on the back of the pastern. A digital pulse you will not normally be able to feel. If you do, it will be very slight unless there's a problem. Such problems could be laminitis or an abscess. When you are looking for a digital pulse, make sure to look in all 4 feet, because if there's a problem in 1 foot, you're only going to find it in that 1 foot. So now we will take our horse's pulse. So when we do this, we're going to find the artery here, and then we're going to time for 15 seconds while counting each pulse, and then we will multiply that number by 4 to get our beats per minute. So we find the pulse here. Whenever you're ready, Gabby. So I got 8 pulses, so you would multiply 8 by 4, which is 32. The normal pulse rate of a horse is 32 to 44 beats per minute. So Moody is right there within normal. The vital sign we will be looking at is the skin pinch test. So this is going to test for hydration of our horse. So when you do this, you're just going to take a pinch of skin, and then you're just going to release and see how long it takes to go back. So normally a skin pinch, you want to go back in 1 to 2 seconds. If it tense and hold the position, that could indicate dehydration of your horse. However, it should be noted that an older horse or a horse with a low body score condition, they could take a little bit longer to go back to normal, such as Moody. Moody here is an older horse, so his skin pinch takes a little bit longer than your average horse. We will be taking the respiration rate of our horse. The respiration rate of a horse should be 8 to 16 breaths per minute. When taking the respiration rate, we're going to watch the rise and fall of the flank instead of looking at the nostrils. If you look at the nostrils, you could accidentally count sniffing. It's a breath, when in fact they are just sniffing at something and being curious. So, we are again going to time for 15 seconds and then multiply the number of breaths we get by 4 to arrive at the number of breaths per minute. So during those 15 seconds, I counted 2 breaths, which would lead us to arrive at 8 breaths per minute, which is in the average range. The next vital sign we will be taking is gut sounds. However, if you believe your horse is colicking, gut sounds would normally be the first thing you would check. So when you check gut sounds, you're going to check in all 4 quadrants of the stomach. You have an upper and a lower on both sides. So when you're listening to gut sounds, you want to hear babbling every few seconds. There should be noise happening. If you don't hear any noise, that could indicate a blockage or a stopped gut. You can hear hypermodal sounds, which would sound like rushing water or a waterfall. That is also not good. That could indicate spasmodic colic. If you hear pinging, that could indicate an air pocket or a gas colic. So now we're going to take our gut sounds. So you can do this using either a stethoscope or your ear. I'm going to use my ear today. So when you do this, you want to put your hand on your horse's rump so you know where he is and he knows where you are. And so Moody has normal gut sounds, and that would indicate his gut is working normally. Now we will be taking our horse's temperature. To do this, we can use either a digital or a mercury thermometer. I will be showing both today. First, we will be using a digital thermometer. So first, we're going to take our Vaseline, and this is used to lubricate our thermometer to make it more comfortable for the horse and easier for us to insert. So we're just going to rub this all over the end. Now we will approach our horse. And now we will turn the thermometer on by clicking the button. We're going to wait for it to reset itself. So when it has the little L, we know that it's ready. Then we are going to insert it into the rectum. And then we're just going to angle it slightly to the side so that we're taking the temperature of the rectal lining instead of the manure. So now it's beeped. So we're going to take it out and read it. It reads as a 96.3 degrees Fahrenheit, which is a little on the low side. However, a digital thermometer reads a little lower, and this horse commonly has a little bit lower temperature. So this is his normal. So now we're going to take our temperature using a mercury thermometer. So when we start with this, we're going to shake it down below 98 degrees Fahrenheit. When doing this, make sure that there is nothing in the way so that you do not break your thermometer. So once it's down below 98, we're going to take some Vaseline, which I already have here on my fingers, and we're just going to lubricate the end of this as well. Now again, we're going to approach our horse. Make sure he knows your back here. You're going to take this clip here on the end, and we're going to clip it to the top of his tail. This is so that we cannot lose the thermometer. We're always going to clip to the top of the tail, not the bottom, so if he decides to swish and fly, it does not pull the thermometer out. So again, we're going to raise his tail, gently insert the thermometer, and again, we're just going to tip to the side. Mercury thermometers tend to be a hair more accurate than digital. And we're going to do this for 2 minutes. So, Gabby, if you want to start timing. Now, the average temperature for a horse should be 99.5 to 101.5 degrees Fahrenheit. And then again, a digital thermometer will read a little bit lower than mercury. Okay, so now that our 2 minutes is up, we're going to gently remove our thermometer and then unclip from the tail. Now before we read it, we want to wipe our Vaseline off so that we can read it more accurately. Okay, and if we read it here, our temperature is 97.9. which again is just a little bit higher than the digital thermometer was. And again, this is not quite in the normal range for the average horse. However, for this horse, it is his normal. So it's nothing to be concerned about with him. Thank you for watching my video on how to take vital signs. I want to give a big thanks to my partner Moody here, and I also want to thank my handler Gabby.